Good afternoon. Happy Motivational Monday. This is Vibration Training Lady Debbie. And today we're going to go over a very big topic. I'm going to ramble for a little bit, but I'm going to shake a bit as well and give you some ideas. But today we're going to talk about pre and post surgery use. And, the first thing I kind of want to put out there is, with these vibration machines, that they seem more complicated than they really are sometimes. They've been explained in 10,000 different ways, and still people kind of get stuck at grasping at, what exactly are they doing and why would I use one, especially if it's a pre or a post surgery situation. So the real premise of why you would want to use a vibration machine is it's going to make what you are supposed to be doing, whether it's a pre or post surgery situation, a little bit easier, little less effort. It's going to help manage symptoms. Passively, you have symptoms before and after surgery. Sometimes they're the same, sometimes they're different. But the biggest advantage to using a vibration machine in a therapeutic way is because it's so low impact. It's low impact for two reasons. It's a low impact activity, but because we're spending less time doing our thing on the machine, whether it's a squat, whether it's a stretch, if we can reduce the amount of time you're spending doing a position, less time and exposure on the joints. So it's kind of a win-win on that note. So I want to go over a few things, and we're going to go over to the machine and talk and shake at the same time. If you are joining us today and you are in a pre or a post surgery situation and you're looking for some guidance, one of the things I will say, if you're using a machine now, getting ready for surgery, or you're familiar with using it prior to your surgery, you tend to be a little more curious about using it after your surgery. It's a little bit scary and harder to understand the concept of using a machine if you're using it for the first time, recent surgery situation. So you're not really, your average self. You've gone through something traumatic, and you're introducing a new technology. So if you're looking at using a machine specifically for post-surgery use and you don't have any experience using one, I absolutely recommend discussing suitability with your trainer or your therapist first. Hopefully they've got some knowledge in one. If you do not, there is some guidance out there, but I do recommend, don't be trying to squat for the first time on a vibration plate 2 weeks after you've had a hip replacement. If you have been using a machine prior and you know how it feels and you know how amazing it is and all the wonderful things that it does for your body, a lot of what I'm going to say today resonates with you. The biggest difference with a new user and someone that has experience is the fear. We're always scared of something new. We're reluctant, and a vibration machine is no different. So if you're looking at using a new tool for the first time post-surgery, make sure you're working with experienced hands and guiding that. So if you are here today and you're looking for some help, you've got a machine and you're getting into a surgery situation, you're trying to get ready, or you're thinking about using it for recovery, we're going to talk about some of that stuff today. Tell me where you're from. Tell me what's wrong with you, to give me some examples to talk about today. And if you do have some questions as things come up, maybe it's not a recent surgery, but something that you had some time ago, and you want to pick things up, there's lots of ways that you can use your machine to expedite benefits in a number of ways. So we're going to get started here. I always start with a stool. Maybe you're not in a situation where you should be bearing weight, or you're not able to bear weight for long periods because you're dealing with fatigue, or you've just had something done to your body where you're not supposed to be bearing weight. So a lot of times in my routines, I'll use a stool just to help you with fatigue, or if you need to do a rest between exercises. But if you're using your machine pre-surgery, you're probably going into surgery for a reason. So you're dealing with some pain or some symptoms of some kind. If you're using a machine post-surgery, you're probably not supposed to be bearing weight completely, or maybe there's certain body parts that it's hard to do your regular routine. So always have a stool available just for fatigue levels, and sometimes it's a necessity for the exercises you're supposed to be doing. We're going to go over different motions as well. So depending on the type of surgery that you are getting ready for or recovering from, there's a couple of basics that are universal. So one of the basic things I want to talk about first is you as a person where are you physically starting. I'm going to get this machine going because it's funner than just standing here talking. I'm using the machine in oscillating mode, which is the teeter-totter side-to-side movement. 90% of what I talk about is in oscillating because that's 90% of what is being used out there. It's kind of the foundational movement of these machines. If you are working with a Rumblex, a Turbo, some of the other machines that have multiple movements, there are some pros and cons to having multiple movements, especially in a pre-post surgery situation. If you have pulsation, so depending on where you're physically starting, well, if you're getting into a surgery situation, you're probably in pain or, like I said, dealing with symptoms. And pulsation is a really nice light setting to get some circulation, some lymphatic movement. You're probably sitting a lot more. Your activity levels have probably declined. So the nice thing about using your machine, just from a feel-good perspective, is just to get some blood going, get the oxygen moving through your system, give yourself some energy. Those are going to be concerns before and or after surgery. A lot of these things that you're dealing with are universal. It's when we get into some of the strength positions and I start talking about whether you should be bearing weight that are going to be a little different post-surgery. So something else to keep in mind when you're using a machine, right now my feet are just about hip width apart. You shouldn't be wider than your hips, especially if you're dealing with something that has compromised you, you're not yourself. If you're finding the intensity on any speed is too strong, amplitude is your very best friend. Amplitude, when you're using a vibration machine in oscillating mode, is how close or how far apart your feet are when you're standing on the machine. The wider you stand, the more you're going to shake. The closer together you are, the less you're going to shake. And if you've had a recent hip replacement or some incisions, the less shake, the better. The other general recommendation for pre and post surgery use is to get up to a mid to higher speed range. So you want minimal amplitude or distance. If you're using pulsation or lateral, that is not adjustable, only in oscillating. So wide is more, close is less. Feet or hands, doesn't matter. And I want you at a mid to higher speed range. Going faster, especially if you're dealing with pain, you've got recent incisions, the slower you move, the more the body's moving back and forth and reacting with that motion. So by bringing it up to a mid to a higher speed range, it's going to be smoother. It's going to be more tonic. It's going to be more comfortable if you're dealing with pain of any kind. The next thing I want you to keep in mind as well is you personally, were you fit before the surgery, or are you trying to cram 20 years of being inactive into a week before you got to go under the knife? There's certain things that you can do on the machine, and even if you only had a day before you go in for surgery, you are going to get some more benefit, but you're not going to lose 100 pounds. You're not going to get super strong. Be realistic with who you were before you went into the surgery, because that's very much going to dictate what you can do after the surgery. What is your starting point? Were you active? Were you inactive? Perhaps you're dealing with other issues. So sometimes with a surgery situation, let's say maybe you had a hip replacement, but maybe you've got spine issues or degenerative disc, or you've got, so some of the things that I'm recommending don't always include other conditions. You've always got to keep in mind exercises that you're not supposed to be doing or stretches you're supposed to be avoiding. And when you're working with a therapist pre or post surgery, the easiest way to incorporate your machine is to use the exercises and protocols that they've probably outlined for you already. So those things that you're supposed to be doing to get ready for surgery, and the things that you're supposed to be doing after surgery. There's going to be a basic outline of exercises and stretches you'll be working with your therapist. What a machine is that environment that reduces the amount of time that you spend doing those exercises and less effort and exposure on your part. The biggest key using your machine pre or post surgery is consistency. So if you are dealing with a lot of pain, if you're suffering fatigue, there's a little bit of a rule change as far as how often that I talk about when you're using for pre and post surgery. I would prefer more frequent sessions and kind of let your symptoms drive that. So, for example, if you're dealing with pain, numbness in the lower extremities. Let your symptoms decide when you need a treatment. Think of this machine as a treatment. So right now, I'm going to bring the speed up. Let's say I'm dealing with some swelling or some neuropathy because I've been sitting all day from my recent hip replacement. So bring your feet closer to the center. You want to make sure your legs are nice and straight. I've shown this position in a lot of different videos. And what you want to make sure is happening, that you're doing it perhaps just until the pain subsides or until you start feeling some sensation. You should really only need about 1 to 2 minutes. If you're just using this strictly to treat symptoms, it's not about doing a 10 to 15 minute workout or run just because your machine's preset time allows for that. So please use some common sense. And why would you want to just do this a couple, 3 times a day, even hourly? If you sit a lot and you're dealing with severe conditions, there's nothing wrong with using your machine as needed, but the time will be minimal. It's going to improve your circulation. It's going to move your lymph. It's going to help you manage pain. It's going to break up that sitting. If you are able to weight bear, so just as a prior surgery thing, the best exercise that you can practice before surgery is a sit to stand, because guess what? You're going to be spending a lot of time sitting and standing up and sitting back down. So just slowly standing up onto your plate, keeping a little bit of a bend in your knees, like you're not standing up totally. You're not going to feel it much above the chest, and then sit back down. Okay? Doing 3 to 5 reps of this instead of just sitting there and massaging your feet if you're able. Even if you've only got a week before you go under the knife, you're going to notice a tremendous difference in your range of motion, your stability, your flexibility, mobility. There's a lot of illities. But what you need to do is, even if it's a couple of days and you've got one of these sitting in your house, use it before you go for your surgery. You're going to feel better. You're going to sleep better. And it'll get you used to it again. If you do decide you want to use it post-surgery, you're not freaked out because you haven't taken it out of the closet in a year and a half. Okay? Other things that you can do, we're still talking a little bit more pre-surgery. If you are getting ready for hip or knee and your range of motion allows you to get down on the ground, I recommend hitting it with some massage. If it's your knees, I want to show you a couple of variations. One of the big things when it's a pre-surgery situation, some of you have been waiting a long time. You want to get the surgery done, but you've been on a waiting list or for whatever reason haven't been able to get in to get the surgery done. So you're hurting and you're dealing with swelling. This is a really good way to massage the calves. If you do spend a lot of time sitting and you're able to get down on the ground, you don't have to just sit there or do the sit to stands. A minute or 2 as needed for swelling in the lower extremities. Perhaps you're getting ready for some laser surgery on the veins or the varicose. Maybe it's not just a knee or a hip replacement. There's lots of different cosmetic surgeries that an improvement in blood and circulation is going to go a long way with as well. If you are dealing with knee pain specifically, my little pole noodles, one is a full noodle, one is cut lengthways in half, depending on the size of your knees and your legs. If you want to get into the back of the knees, this is a really gentle way to just target those knees more specifically, okay? And I'm just sitting in a relaxed position, but while I'm already in this, maybe, you want to build up a little bit of strength, or you're working on things post-surgery. If you're doing any kind of leg lifts, this is a really easy way to utilize your machine to get more benefit in less time. Again, that's the biggest advantage in a pre and a post-surgery situation. You've been doing a lot of time sitting. I tried this one last night. If you've got the yoga rings, the swirl wheels, and I just lean back and I'm stretching my back at the same time. Breathe, relax. I don't want you doing a whole bunch of extensive exercise a week before you go under the knife, but there's many things that you can do to improve your overall sense of well-being, your tension, getting a few good nights sleep before you do go, okay? So don't beat yourself up if you can't do a whole bunch of squats and things to get strong beforehand. If you can, anything that you can do, like I said, the sit to stands, a couple of squats, A couple of days before surgery, you are going to feel more mobile, more stable. There is still benefit. Okay. Next one I want to show you, perhaps you're getting ready for hip surgery, low back surgery. You've got tension in the neck and the shoulders. When you've been dealing with chronic issues, sometimes our body builds tension, just because of how it compensates all the time and all this pain that you're managing. So if range of motion allows, just sitting on the machine, getting the stimulation a little bit more direct to the areas that you're about to get repaired, if you will, is a great way to get not only some circulation, but get rid of the tension that all that pain is causing. And your posture has probably gone out the window because you're sitting in all these funny ways to compensate for the pain on the hips. You really only need for any of these massages maybe 1 to 2 minutes as needed throughout the course of your day to manage symptoms. You don't need to go for 10 to 15 minutes. 3 to 4 times a day is not unreasonable. If pain is severe and it's managing things for you, feel free to use it more often, but you don't need to add longer time. From week to week, I wouldn't build on your time. Just change your settings a little bit. So right now, let's say I'm massaging it at the 50 range. Next week, do it at 45 or move it up to 50, 55. You can keep your positions universal, but you can change your settings up from week to week rather than adding more time. The goal isn't to go longer and longer, okay? Let's say we're having surgery from here up. Maybe you're having some tendon work done, something done on the wrists, carpal tunnel, those types of things. Just like the lower extremities, we women especially tend to forget about the upper body until we've got to put our bikini top on in the summer. So if you are dealing with carpal tunnel, arthritis in the hands, you've got swelling, you've got pain you want to manage, that these pull noodles or your palms flat on the plate, just getting some circulation and some lymph going is going to do wonders. Again, play with what type of movement. I think you'll find pulsation is fairly comfortable, but you may not like the head buzz. If you're using oscillating, bring your hands closer to the center and reduce the amount of movement just till you get a feel for it. If you want more intensity, you can widen them up from there. If you've got a little bit of tension in the shoulders and you want to get a bit more action that way, if your knees allow, I've shown this in other sessions, but we're not doing this for fitness. We're strictly doing this to get some lymph and some circulation. I've got next to no body weight going into my upper body, okay? Try and relax. Don't fight the vibration. Keep your hands and arms in line with your shoulders. And again, 30 seconds to a minute on something like that as needed, just to get the blood and the lymph going, get rid of some tension before you go in for those treatments. Another way that you can do post-surgery, if you are dealing with, swelling, pain, it's okay to use your machine post-surgery, but I want to talk a little bit more about weight-bearing versus non-weight-bearing. I just want to check in on questions really quick. Hello, who is here today? Hello, Lisa. That's me so cramming. I was speaking earlier about trying to do everything in a week that should have been done for the last year. DM, I bought and used a vibration plate before my hip replacement, May 2021. Not sure when I can resume. You're well past. And perhaps what I'll do is I'll take a second and talk about some post-surgery situations. Most of what I was covering just now, up until now, was more, I don't want to say, there's so many positions that are universal, but I want to increase. So many people don't think about using their machine until after they've had the surgery. There's a lot of ways you can use it to get benefit, getting prepared for surgery as well. Hi, Pam. Just became a CLTRN. Oh, congratulations. Good for you. Hello, Lynn from Buffalo. I just want to get back to DM for a second. So a big question, probably the most common question I get as far as post-surgery is, how soon post-surgery can I use my machine? And it's not really a how soon can I use my machine question, because it varies depending on you and the surgery and how your recovery is going. So some of the things I talked about earlier, you and your personal body, the level of health and fitness it had before you went into surgery is going to be the same body when you come out of surgery. So, there's going to be limitations for some, depending on your level of health. Maybe you've got other conditions that you're dealing with. But as long as your recovery went okay, Dom, and you're bearing weight, meaning you're walking around and you're making a sandwich in the kitchen, you are fine to use your vibration machine. What I would caution is if you are deconditioned, meaning, you haven't been using your machine, but you haven't been terribly active with other things, start moderately, 3 to 5 minutes, in a standing position. It's very easy to overdo it. And a lot of people think, oh, it screwed up my new hip because my hips were so sore. No, there's a lot of little muscles in there that have become deconditioned. And sometimes we forget that, we exercise, and if we do more than we're supposed to, it hurts. So any ill effects you're going to have are typically more in line with what exercise would outline. So should you be exercising yet? Are you able to bear weight yet? Are there exercises you're supposed to be focusing on and ones you're not supposed to be focusing on? So all of these types of questions are more general than the machine itself. So the biggest question as far as can I use my machine post whatever it is really going to be driven by your doctor and your surgeon, your therapeutic team. So if you are able to bear weight, generally speaking, you are able to use the machine. But I would recommend reduce, even if you're extremely super fit and you're super active, the body has gone through some trauma. Some areas have digressed. And the reason you want to use it post-surgery is to expedite recovery and healing and all the wonderful soft stuff we know these machines do. But if you do have an outlined protocol of exercises or particular things you're supposed to be focusing on, you can also use the machine as a tool to reduce the time, the effort, and give you a little bit of added benefit. Consistency is always key. DM is very fit. Okay, so if you're very fit and you're doing like CrossFit already, your machine isn't going to hurt you, honey. You are totally fine. What I would suggest is if there's any particular exercises that you're not supposed to be doing or stretches you're not supposed to be doing, same rules apply here. But I think you'd probably find as a warm up and a wind down, if you're doing other things right now, DM, I think you'll find it will be almost a game changer. And a warm up and a recovery session, it doesn't need to be a whole workout either. It could be, maybe you're doing legs at the gym and you want to do a couple 3 minutes massage or a couple of squats. The machine, if you're active in doing other things, use it for the things you're not doing as regularly. And my guys are really, I don't want to assume that DM is a guy, but I'm gonna say maybe you're a guy. That's just what my spidey senses are telling me. But my guys are really bad for stretching and warming up. We don't need to until it hurts. And then once we fix it, we stop doing it. So use it for 3 to 5 minutes pre-gym, post-gym. Use it to target after what you haven't hit at the gym. Maybe some core, use it in complement to other things that you're doing. It can be a workout on its own, but if you're doing other things, the adherence of putting them together and combining them is going to ramp up the results of everything. I go to stretch and tone classes 3 times a week, many months since surgery. Thank you. Awesome. Okay. So, the biggest thing that you can do for recovery is listen to the people that are telling you to do your stuff, consistent, doing your exercises, even if it's just light walking, the sooner you can get things moving and flowing once you're able to bear weight, the better. You can use your machine if you're not able to bear weight, but this is where Debbie gets into this big gray area again. So, maybe you had shoulder surgery, maybe you had neck surgery, maybe you had hip surgery. I'm going to show you something you've probably seen before. This is not weight bearing. So for those of you that do use your machine regularly and you haven't been using it because you're too scared after that hip replacement or shoulder work or what have you, I'm going to say 4 to 6 weeks post surgery. And everybody's different, so it depends on how your recovery is going. But generally speaking, even from some of the big surgeries, you're usually bearing weight within 4 to 6 weeks. So there are ways that you can use your machine right away with guidance. I highly recommend using a machine to mitigate the development of scar tissue, get lymph going, circulation. But I do a lot of individual consultations for specific post-surgery stuff. But as a general rule, if it doesn't hurt, you are probably more than fine using it in a seated position. So when I say it doesn't hurt, you might feel a little itchy, you might feel little pins and needles, but anywhere basically from mid-thigh up isn't even exposed to the machine. So post-surgery, when you're spending all this time sitting on your bum from that hip or that back or shoulder, this is absolutely fine as long as it's comfortable. It is going to get some lymph and some circulation going. I've done seated routines before. You don't have to just sit here. If your range of motion is not good, I don't recommend getting down on the ground and being a rock star and doing massage. It's never the getting down, it's the getting up. If you want to get some movement going on upper body, and a lot of these positions I've done in the past, but today we're calling it pre and post surgery use. You know, for some people it might be I have poor range of motion and I just can't get down there. So any of these exercises are very low impact, next to no weight bearing. If you want to get a little movement through the back and the shoulders, just place your elbows on your knees. If you're finding it's too intense, again, distance between your hands or your feet always drives the amount of intensity. So what if you are able to stand, but maybe, you know, you're scared or you've got vertigo or something of that. So, you know, starting sort of weight bearing might look something like this. Maybe, you know, this is the bad leg and you're afraid to put it on the machine yet. Well, you could put the good leg on the machine, or if you got really good balance, you can even, the good leg's been doing all the work anyways, guys, for the last couple months. So it needs some attention. You could put it right in the middle of the machine on its own and kind of just stand there like a flamingo. You're going to get more of a full body effect. But if you're afraid to put the new hip or the new knee or whatever on the machine, you can still stand on the good leg. You know, you've probably been hopping around the house like this and it needs the attention. So if you have had super recent surgery and you have been told not to bear weight on that joint, I do not recommend putting it on the machine yet. When you're able to is really going to be driven by what your surgeon and your therapist has said as far as weight-bearing activity. This isn't a separate activity. This just helps make the activity easier. I hope that makes sense. Okay. I walked away and I saw questions popping up. You're a woman. Well, good for you for being fit and asking questions. Sorry, I wasn't sure. I keep thinking DM Dom maybe. So I hope that offered a little bit of insight. If you're well beyond and you're doing your regular routines, there's absolutely nothing wrong with using your machine. If you had one prior and you were using it, you tend to miss it. That's one of the big things if you've been using a machine for a period of time before you go into surgery or before you had an accident. You miss how it makes you feel. You miss that energy. You miss the mobility, the light and fluffy feeling it gives you. So you tend to have the confidence or at least the curiosity to want to use it post-surgery. That's something I see very commonly. Who else? The platform was the best way to relieve that I've gotten after my surgery. Heidi, let us know what kind of surgery you had. And you guys let me know where you're from too. You know, sometimes if you're in colder areas, you know, we have things like slipping and falling on the ice. You know, sometimes it's not a planned surgery. Sometimes it was just life that got in the way and we tripped on ourselves. What am I helping someone post tummy tuck? Same for men. There's reasons you'd want to for sure. Again, that mitigation. I do a lot of support for lipedema, Derkham's disease, where very commonly they're getting liposuction surgeries or sections removed and using in a seated fashion just to get the blood flow and the circulation going. But the slow speeds are uncomfortable on incisions. So close feet and high speeds. I wouldn't be laying the tummy directly on there, although that is a position that we do once everything has adhered. Standing on the plate for something like a tummy tuck, it really depends on how the healing on the skin surface. We're not dealing with anything structural, so it's really a tolerance thing. Scar tissue is really ramped up in that first 4 weeks. So if you could get on it even moderately right after something like a tummy tuck with guidance, a lot of my plastic surgeons do recommend it as a pre and a post treatment thing. But make sure, you know, everybody's level of tolerance and comfort is different. So feet really, really close, high speeds, get those speeds up and make it smooth. And you can really expedite that blood flow and expedite the recovery process in a lot of respects that way. I go to stretch, toe classes, I talked about that. I'm 10 months post heart, and I was using the machine and working out before my surprise surgery. Heart attack, heart transplant, because I've played with it all. Vibration machines are phenomenal for anything cardiovascular related. Why? If you're having heart conditions, you have no energy, you have no wind. You go to the bathroom and you feel like you've done 10 miles if it's very, very severe. Very similar to my any of my respiratory COPD. You lack energy. So the coolest thing about a vibration machine pre and post surgery for anything cardiovascular, outside of how amazing it is for the blood and the lymph and the oxygen and all that, is you can get a lot done in a short time. The last thing we want to do is take away the little energy that you do have. So using a machine in very short bouts not only reduces the risk substantially, but it actually gives you energy. So one of the big reasons that I recommend post-surgery, lots of short little sessions as your body kind of lets you know you need a fix, is it ideal for cardiovascular, heart surgery, post-surgery, those type of things. But again, you want to make sure that you're adhering. On hearts, I will talk about another type of pre-post surgery because it came up in whoever brought up the heart thing. Deborah, awesome name, by the way. Pacemakers, probably one of the most talked about. It's on everybody's contraindication list. I'm going to dispel the myth about pacemakers. Can you use a vibration machine after a pacemaker? Yes, you can. A, if you understand what you're doing, and B, if you understand what you're doing it on. There are very mixed reviews, and it's usually safer for a company or a therapist if they're not versed to, don't do it. Because when you think about it, you're shaking, you got this electrical thing. You would think it's a bad thing, but the risk with heart surgery is the frequency of the machine, not the movement itself. You're getting more shake running across the parking lot to get to your car than the machine is going to expose you to. What I will say is if you have a pacemaker and you are a woman, sometimes because we're a little bit smaller up here, the pacemaker isn't right on the big chest muscle like it is with the guys. It might even be over into the arm a little bit. So I would be very cautious if you are not doing upper body exercises before you had your pacemaker started. You have no business doing a push-up on a machine. Work with a trainer, get some technique down, learn how to do a push-up properly before you try it for the first time on a machine. So sometimes if we're younger, a lot of my pediatric kids do have pacemakers for arrhythmias or different things. So you may, if it is not on the big chest muscle, you want to make sure that you're okay to be doing upper body exercises. Has nothing to do with a vibration machine. If you are using vertical or pulsation, I'm getting into trouble for this, but there's some studies out there that say vibration machines are not good for pacemakers. What I have read personally, it falls more into the realm of vertical technology where the frequencies are much higher. And these were big bad medical devices back in the day. They had a lot of energy, a lot of amplitude. They don't really compare to the pulsation I'm getting a little fuzzy and I'm trying to focus. See if it focuses better. Poof. No. Okay, sorry, I'm a little fuzzy for a second here. Oh, there we go. But if you are doing anything post-pacemaker, post-stent, post-heart, post-anything, the biggest symptom is that wind. You're lacking energy. So that's a good reason to use the machine to give you that energy boost. But I would avoid upper body exercises unless you're confident and we're doing them prior. Pacemaker is kind of the same as other surgeries. You can use and resume your stuff when your doctor has said it's okay to resume your stuff. That's not just a vibration machine. You don't have different activity guidelines post-surgery. You wait 3 weeks before you use your treadmill and 12 weeks before your Pilates machine. No, it's an activity thing. When are you able to bear weight? When are you able to strain those muscles? Those are the type of things that you need guidance on from your caregiver. To Kim Boggs, Kim, I hope that helped. Can this be used 10 months post heart surgery? Thank you for more specific info there, Deborah. It depends on how the recovery's gone. So Deborah, if there's been no infection, your recovery's gone really, really well, there's been no complications. Sometimes with heart surgery, there's different medications and sometimes it takes a period of time to get the ideal dosage or type of medication. So as long as you're kind of doing your thing and you're living your life and things have recovered, you should have no issue using a machine. If you are using one for the first time, I suggest watching some of the videos on here as far as a newbie. Where do you get started? You probably have other issues that you're wanting to address too, maybe some strength, or maybe you're dealing with arthritis. We're never usually dealing with one thing. So yes, if there's any other chronic conditions, you might want to look at something that's going to encompass all of your goals. But I recommend it as a general rule, if you're dealing with any kind of surgery and you're resuming use on your machine, keep your durations short and more frequent, at least for the first few weeks, until you kind of get a feel as to what your limits are. We want to make sure we're not fatiguing you. It's always easier to do more later as opposed to try and take it away. It's kind of like a tanning bed, I always say. So if you go tanning in a tanning bed for the first time and you sunburn yourself, you can't take that time away. But if you only went for a few minutes and you didn't really get enough exposure and no color, you can always go a little bit longer. Same with the machines and just activity in general. It's very easy to overdo it, especially if you are active in your work, or just you live an active lifestyle. You go crazy just being confined and not being able to move. So less is more starting out, and let it give you the benefits of recovery before you start pushing yourself on the rest of it. Heidi had arm surgery. Depending on the type of arm surgery, was it tendons? Was it bones? Was it cosmetic? If you are able to resume exercises, arms are a little different. Sometimes you might have discussions with your doctor. They may or may not recommend certain pull or push activities because of how they interact with the tendons and the muscles. A vibration machine is a push activity. Think push up. You're not pulling on the machine. You're pushing and resisting statically to start. So sometimes when you've had surgery on the arms, there are definitely some pull exercises that you maybe have told to avoid, stretch bands, those types of things. So depending on what you're using your machine for, but from a therapeutic standpoint, some massage, some non-weight bearing, if you're able to roll your arms on or apply them to your knees in a seated position, just to get things moving and flowing again, Kim or Heidi, I think you'd really enjoy the benefits. If there was something more crazy going on, like a funny break or you had a re-break or multiple surgeries, sometimes it's a gray area. But generally speaking, as long as you're doing your day-to-day and living your life, you should be okay using the machine. Just start with short durations. Denise is from Florida. Thank you. How about after a total knee replacement? Ooh, that's a good one, Vicky. Thank you. Every physical therapy show I've ever been to, there's this divide in the sea of therapists, and some have heard somewhere that you can only use a machine on a partial knee replacement, and some say you can use it on a total. And I always say, well, where's the study? Show me, because I have to answer these questions all day long. So if I get, I have questions sometimes too. I have many clients with total or partial knee replacements that never called me before they started using their machine, and they survived. So, I don't want to sound callous, but there's a lot of people out there, again, as long as you are using it within recommended activity outlines, so you're not using it prematurely, you're not bearing weight when you're not supposed to. With a total knee replacement, there's other things adhering depending on the type and of surgery that you had, but very commonly you might feel around the incision area where those muscles were cut and those tendons were cut. You might feel like a little pins and needles or an itchiness more in those areas. Please don't be spooked. There's a lot of activity going on, and they're really deconditioned after something like that. So I would suggest for sure, Vicky, try seated. Don't put a whole lot of body weight into it. If 4 to 6 weeks post-surgery, bring those feet really close together and get your speeds up. See how it feels. It's going to do a lot. There's a lot of trauma from the surgery, a lot of medications, detoxification, all kinds of things it can help with. But I don't want you bearing weight until you've been cleared to do so. That's a very, very important thing, not only with a total knee replacement, but with any kind of surgery. Let me see here. I have Tammy from North Carolina, no surgery, but here, just for information, waiting for diagnosis, possibly lipedema. I deal with a lot of lipedema. Please feel free to check out I have a group called Vibration for Fat Disorders. Fat disorders are real. They're not just because, maybe you ate too many Twinkies for a couple of years. Lipedema, Derkham's disease can be very painful conditions, and these machines are very popular for their capacity to move lymph and circulation. So a lot of people are using them in that community for their self-care. So there's lots of information. If you look up my profile, Tammy, you'll find the group. But I do have requirements that you have a condition, or at least are leaning towards that. But yes, I have a lot of them that are using it post-surgery for liposuction, using it to get prepared as ready as they can for surgery. So that's absolutely something I highly recommend. And they are recommended by Dr. Karen Herbst, Dr. Catherine Sale. There's a lot of very qualified people in the community recommending vibration plates, and many of them recommending LifePro. Kimberly is having left hip replaced Friday, had left knee done on March 2021. So the right side's been doing a lot of work for a long time, Kimberly. I don't know if you saw, but if the right leg is okay, I'm sure you could really benefit from just getting a little bit of total body exposure. If you have not been using your machine out of fear because of the past surgery, it's not going to hurt you, but it is going to be really itchy and pins and needlies, because it's kind of like starting out fresh and you've got a lot of blood flow and scar tissue. So even in a seated fashion, you've got till Friday, get some blood and some lymph going at the very least. Get some muscles relaxed before you go under the knife. Try some sit to stands where you're sitting on a stool and standing up onto the machine. Mimic what you're going to be doing in recovery. You've got a few days where you could absolutely, it's certainly not going to hurt you. I think you'll be surprised to see how much benefit. And use it 3 times a day. You've got to be suffering in aches and pains at the very least, and some swelling. Heidi has some carpal tunnel, and you've had it or you're going to have surgery on those, Heidi. Just let me know. Heidi's letting us know. She says surgery, but I'm curious if it's past surgery and you're using this as a recovery, or you want to use it to prepare for. Also, let me know how your range of motion is. Ronnie replying back, did you speak about weight loss surgery? I did speak briefly about a tummy tuck. Depending on the type of weight loss surgery, could be gastric bypass, could be skin surgery. Your recovery and whether you're able to use the machine from an exercise standpoint is going to be determined by your recovery plan. So are you to be doing exercises or not? But if you've had cosmetic surgery of any kind, if you are able to tolerate the use of your machine, even seated in a stool, you can expedite recovery with the circulation and the lymphatic benefits. If you've had an incision, it really depends. I think you'll find a faster speed with minimal movement is going to be much more tolerable. But don't lay that area directly on the plate unless you've been cleared to get massage and other type of activities. If you've got a fresh incision, leave it off the machine, please. I hope that helps. Weight loss surgery, that's a big topic, so it really depends on exactly what you've had done, Heidi. Heidi's Ronnie. Heidi, I used a vibration plate after surgery and PT, and I've bought my own. Also have PSA. It's amazing. Oh, that's awesome, Heidi. Yes. Again, and your confidence using these tools, especially post-surgery, is going to be much, much higher if you had experience using it prior. So a lot of people, believe it or not, buy these machines and they never take them out of the box. If that's you, take it out of the box, get used to how it feels, get the itchiness and all the new stuff over, so you have this amazing tool to use after your surgery. You don't need to be suffering if you have one of these machines, but you may require some guidance and some guidelines to know if it's okay to use it post-surgery. Ronnie replying to Ronnie, thank you, maybe a sleeve or guide to gastric bypass. I would, if it's a recent sleeve or gastric bypass, I would say standing and sitting on the machine at least for a couple of weeks is advisable. Not because I think it's going to cause any harm, but we don't really know what's going on yet. We don't know if you're recovering well, if there's any complications. So, give your surgery time to do its job. But if you have had gastric or any type of intestinal work, it really depends. An increase in circulation can be a good thing, but it may also cause discomfort if you're not ready for it. So general weight bearing, any type of activity or movement, you want to make sure that your doctor or your surgeon has allowed you or okayed you. So have that discussion with them. Otherwise, I wouldn't use it other than seated on a chair. If your range of motion allows, you can totally sit your bum down on the ground and do your legs, but I wouldn't sit directly on it or get your tummy anywhere close to it until you're ready for that type of movement. You're welcome, Ronnie. I don't know if it's Ronnie or Ronnie. If I'm pronouncing your name wrong, I completely apologize. And anybody else who's out there, if you have questions, let me know where you're from, what you're dealing with. My crystal ball isn't here with me today, but I usually have some pretty good insight. It is not black and white. I wish I could give you guys a manual as to, this is exactly how you use a machine pre and post surgery, but it is so driven by you personally, the type of surgery that you're having and how your recovery has went. But there is not a surgery out there in the history of the earth that I probably haven't played with at least 4 or 5 times post-surgery, anything from heart transplants to total knee replacements, hip replacements. I've dealt with Harrington rods, you name it. It's just understanding where and how you are not working properly. And I can usually find a workaround on the machine to at least relieve some pain. If you're in pain, it doesn't matter what I say or what I want you to do. It sucks trying to do anything when you're in pain, and it takes away your energy. So if you can use it to manage pain and swelling and start moving and feeling better, it might even be a viable tool just to get you to therapy in some cases. For the therapy, if you're not going to therapy because it's too painful to get into the car, get on your machine and allow it to soothe you and make you feel better. And there's a bazillion videos. Don't forget going into the VIP section. It doesn't matter if it's a leg workout or a core workout or a massage session. Whether you can use this pre or post surgery is driven by you personally and what your doctor has advised as far as what you are not able to do. I said in total knee replacement, I covered that. Spinal fusion. March 2021, I have a vibration plate. How long do you suggest using per day? Really depends on you personally. If you had a fusion, you're well beyond what I would consider it to be a new surgery. And there's going to be all kinds of reasons you'd want to, like you say, circulation. You had some meds in your system, so detox. But it depends on you personally. I'm not sure how your recovery went, how your mobility is, if you're dealing with other issues. So if it's Mitch Byrne, I hope I'm saying that right. Let me know if you're bearing weight, if there's any exercises you're supposed to be doing. One of the most awesome things about a vibration machine is if there is things you're supposed to be doing regularly and they're just boring and they take too long, a machine can really expedite not only the benefits, but reducing the amount of time that you have to, you're probably going to be more consistently doing it because it's not such a pain in the butt. My recovery and mobility was awesome. Okay, so you probably have exercises you're supposed to be doing. Sometimes with spinal fusions, bulging discs, sometimes there's stretches you're supposed to avoid. So same rules apply here. If there's stretches you're not supposed to be doing, please don't do them on the machine. But one of the best things that you can do on your machine for your back and your spine is just simple little pelvic tilts or get movement going in the spine. I did back and spine, I think, a couple of weeks ago on the group. Maybe it was last week. But back and spine issues, anything that you were doing prior to for your back on the machine is probably going to be just as comfortable on the machine. But sometimes if you've had a fusion, depending on where it is, your mobility has changed or your range of motion has changed. So sometimes just sitting on the machine is a nice way to warm up or relax if you spend a lot of time seated or you're going to do other things at the gym. I also showed last week, you'd want to put a mat on the machine, but for the lower back and spine, this is a really nice way to get into it if you're able to do it like a cat-cow. Any of those things can be done on the machine. So whatever you're doing now or supposed to be doing now, I suggest experimenting with. And the big caution with any kind of surgery, especially the low back, the spine, bring the feet closer to the center. There's a mentality. Everybody thinks we need to move as much as possible. No, Get the speed up, go mid high frequencies or speed levels, depending on which model you have. If you've got 99 speeds, get up to 60 or 70 or even higher, but reduce the distance between your hands, knees, or feet, whatever's in contact with the plate. And short, more frequent sessions, build back up. It's not about going 15 minutes every time. This is like spot treatment stuff, guys. 1-2 minutes, as needed, as your body says, I need it. I hope that helps. And keep me posted if you ever have any issues. And you're a year and a half, almost a year post surgery. Usually, any pain or fatigue you feel is going to be more related to overdoing it. So the same as if you over exercise. So all the more reason I stress just keeping those durations short and purposeful. Okay. I don't have a big parking lot yet. I'm sorry that I'm the person that always seems to have an answer for everything, but I really have been doing this forever. And, I didn't know all of this when I first started. It didn't come in a book. A lot of my experience comes from clients that have had machines as long as I have, 10, 15 years, some of them. And you don't ask Debbie after you've had a machine for 5, 10 years. You do your own thing and you experiment. And a lot of times, if you're just afraid to use your machine, you don't know what you've been missing out on. There's a viable, drug-free, non-invasive tool that has a variety of applications. So if you are, just to recap quickly, if you do not use a vibration machine right now and you've just had recent surgery, I would wait for guidance from someone with qualifications, your therapist or someone that understands when you're ready to start being active, let alone incorporating a machine. Remember, the machine is just a tool. If you're getting ready for surgery and you have a machine or you've been thinking about getting a machine can be an awesome way to get ready prior to surgery. You're having surgery because you're hurting or something's not working right. So it makes the thing easier. And if it's exercises, it reduces the amount of time and impact to your body. So there's a lot of things you can do before the surgery to get prepared and give yourself the best recovery after the fact. If you've got one, even minimal use just to get that lymph and that circulation going. Someone here, I'm really bad with names today. It's Monday, guys. Kimberly, she's getting a hip replacement here on Friday, and I don't know what your pain levels are, but some of the seated exercises, standing with those feet close, get some blood and some range of motion going before surgery. And then, you can use it after the fact, but just refresh yourself if you haven't been using it, and you'll feel more comfortable to consider it post-surgery as well. And feel free to tag me and reach out after the fact. I wish you the best of luck with your surgery. If that is it, we could probably talk for 4 days. If everybody was here and had their own questions. There is so much variety in not only the type of bodies out there, but what you're getting ready for, what you've had surgery for. Some of you have had multiple surgeries, and it's hard. It's hard to get active. It's hard to recover. Let this tool be a way to simplify and get you back to living a better quality of life. That's why you're having the surgery. So if your surgery is due to an accident or an injury that you've had, and you're a fit and active person, please don't overdo it. Don't, the biggest thing that I recommend if you're in a recovery situation is to do the recovery. Be consistent, stick with it, and no excuses. If you've got one of these things at home, even just a couple of minutes is going to go a long ways. It doesn't always have to be a big activity. And use what you're already supposed to be doing. If you've got an outlined protocol or program that you've been working with your trainer or your therapist, this is a way to, for most of the exercises, even if you've got to make some modifications, most of your exercises and stretches can be done on your plate to improve efficiency, reduce the amount of time and impact to you personally. And hey, if it's overdone quicker, you're probably going to be better on the consistency piece, which is the biggest thing that you can do with your pre or post surgery recovery on the machine. Just use it regularly, have a relationship with it, even if it's just simple stuff. Consistency is going to be your biggest friend to success in the long run. Okay, I'm rambling. it's time for me to stop. I don't think we have a live this coming Friday. I will see you next Monday for sure, for in some way, shape, or form. I wish you an awesome week. Don't work too hard, and I look forward to seeing you guys next time. If you do have any questions related to this and were unable to join us for the session today, but really had something you wanted to ask me, feel free to drop it in the comments and tag me. And for any of you that are currently going through surgery or getting ready, this is your motivational call. There's a lot of benefit you can get. Feel free to reach back after your surgery and tag me if you have any questions about post-surgery use. Don't work too hard, guys. Have a great rest of the week. Thank you.